everybody. My name is Dr. Jen Hartley, and I am so glad that you came to hear my lecture. Thank you so much for being here. So just to give you an overview about who I am, I started life as a chiropractor. I graduated in 1999, so I've been in private practice for about 17 years. And through chiropractic, I was looking for the best way to actually get people back to the health that they were looking for. My mom was my primary motivating factor because she had been sick my entire life, so I was looking for a solution for her. So I went to chiropractic school, and what I experienced in chiropractic school is that chiropractic alone, which handles structure, gets a 65% success rate. So when you compare that to sorry, I always cry when I talk about my mom. When you compare that to American medicine, a 65% success rate using structural chiropractic alone is a phenomenal success rate. Because if you look at musculoskeletal issues and you know what American medicine can do for them, you know that at best you're getting about a 5 to maybe, if you're super lucky, a 10% success rate. However, what that I experienced in my office is that when I was getting a 65% success rate, on average, I see about 50 patients a day. So what that meant was that 15 out of those 50 patients were not getting the results that they wanted, were not getting the results that I wanted them to have, and were not getting the results that they deserved. So I continued my training into the field of neurology because I started recognizing that you are not a Halloween skeleton, right? So if you were a Halloween skeleton, I could do my very best maneuver to put you back into place and then gently walk away and hope that you stayed there. But since instead of being a Halloween skeleton, you were actually walking around in your human body, what that meant was that there was a lot of factors that were contributing to whether or not that structure would stay in alignment or not. So, recognizing that your structure is controlled only by your musculature, we had to do something about the musculature. And when I started learning about what controls the musculature is your nervous system. So I continued my training into the field of neurology. And this is what makes me incredibly rare as a chiropractor. I am one of only 101 certified chiropractic neurologists in the entire world. And the focus with chiropractic neurology is rehabilitative neurology, not diagnostic neurology. So people are like, oh yeah, you're a neurologist, that's super cool, my friend is a neurologist. If you're a medical neurologist, you are a fantastic diagnostician. You can figure out what's wrong with you diagnostically, but you don't really know what to do other than haphazardly prescribe pharmaceuticals in order to get some sort of change. What I am is a neurological rehabilitative chiropractor. So my focus is, how is the nervous system functioning? Most of the time, if somebody comes into me and they say, I have been diagnosed with whatever it is that they've got going on, I can guarantee you that they have not been rehabilitated. So you've been told what's wrong with you, you've been given a pharmaceutical to handle your symptomatology, but you've been not addressed in any way in a way that can actually rehabilitate that function. I am the exact opposite. I don't care what your diagnosis is when you walk in the door, and in reality, 80% of the time, if people have a neurological issue or a physiological issue that is in some way related to the nervous system, they cannot find a diagnosis for them. Or if there is a diagnosis, it's simply a diagnosis that's connected to a list of symptomatology. Fibromyalgia is the perfect example of this. There is no real disease called fibromyalgia. It is a list of symptoms. And if you trace every single one of those symptoms back, the source is always the nervous system. So we have a 100% success rate in our office of taking care of fibromyalgia. Because if you rehabilitate the nervous system, it's amazing how much the body will come back into a really incredible level of function. So when I started working with neurology, my chiropractic success rate went from a 65% success rate all the way up to an 85 to a 90% success rate, which was pretty phenomenal. But I started recognizing that if your body has been significantly depleted, sometimes it needs information in the form of nutrition or supplementation in order to know how to rebuild itself. So I continued my training into the field of naturopathy. So then I got my doctorate in naturopathy. So the overview of what I do is I am a doctor of chiropractic with a certification in neurological rehabilitation. I'm a doctor of naturopathy, and my personal preference for how to address the physiology through naturopathy is through herbology. So many people might be saying, well, what the heck is a naturopathist? And a naturopathist is essentially a medical doctor who wants to address the body holistically or through a natural holistic means rather than through surgery or pharmacology. So we understand what's going on in the entire system, and we want to create something that can rebalance the system. Most problems that people will come in with are always being addressed through symptomatology alone. So I have a problem. Let's say my digestion is all whacked out. So I have a symptom that's associated with that problem. The symptom might be constipation or digestive distress or bloating or GERD. And if you've been offered a solution by the medical doctor, most of the time it is a pharmaceutical that is directly to counteract that symptom. So I could symptom orient for the rest of my life, but that would never take care of the problem. So what my goal is always to listen to what's going on, to look at all of your diagnostics and figure out what in the world is going on at the primary core and rehabilitate that. So for the most part, we always want to start with the nervous system, because quite honestly, your nervous system is key. If your nervous system is if your nervous system is communicating 100% to the thyroid, your thyroid's going to be working. If your nervous system is communicating 100% to the ovaries, your ovaries are going to be working. If your nervous system is communicating 100% to the bicep or the rotator cuff, that's going to be working. So I have a very specific technique that I do, which I'm going to demo today. The technique is called quantum neurology, and the brilliance of quantum neurology is it's a field of neurological rehabilitation that came out of the field of quantum physics, understanding how the nervous system works on a quantum physics or energetic level. We are able to test and correct the function of every single nerve within the human body. So if you come in with a certain issue, I'm going to be focused on, well, what are the nerves that control those different body parts, and make sure that they're working. Most of the time, if you've got a symptom, the nerve for that is not working. It's either not working to cause the problem, or because the problem has been there so long, it's pissed off the nerve and now the nerve isn't working. But either way, we want to wake up the nerve. And then as we start waking up the nerves and getting the structure in balance, the next thing that we want to do is make sure that the body has the right nutrients that it needs in order to grow. So we all know that if I take a beautiful tomato plant, organic, heirloom seeds, and another one that's exactly like it, and I plant one in good soil, and I plant the other one in bad soil, which is the one that's going to take off? The one that's in good soil, because everything needs nutrients to grow. So that's where the naturopathy comes in. I could be waking up your nervous system all day long, but if you don't have the nutrients that your body needs to heal, we're not going to get anywhere. So of course, a good diet is always key, but we also want to make sure that you've got the nutrient balance in you to heal whatever it is that you've got going on. So the way that I work with nutrition is through herbology. The reason for that is because herbs are cheap. So my number one thing is I want people to be able to get well. The only way you can get well is if I provide for you a protocol that you can do long term. The only way you're going to do it long term is if it tastes good, feels good, and is affordable, right? So what often happens with people that have been to see a naturopath is they say, oh my God, I've got this great naturopath. She was so fantastic. She was able to really take care of what I was going on, but I couldn't afford her. And then I asked, how much was her visit? Oh, like $100. How could you not afford $100? Oh, it wasn't her visit I couldn't afford. It was her treatment recommendations. So if you get treated through a naturopath, most often they're going to send you home with a whole bunch of bottles. And you know that this is true, because if you've ever seen anybody who goes to a naturopath, you open up their medicine cabinet, thank God they don't have a bunch of prescriptive bottles in there, right? But they've got 700 of these bottles filling their medicine cabinet. And each one of these bottles is going to be at cheapest $20, and sometimes all the way up to 100 or 150. So if you've got a whole complex of this nutrition that you need to take every month, the average person that I've seen that has come to me from another naturopath is getting great results but they're spending $350 to $500 a month on supplementation, which is just simply not sustainable. I make pretty good money. That's not sustainable for me. So my assumption is it's not going to be sustainable for you. I apologize if you've got all of the money in the world accessible to you and I'm making an assumption, but for most people it needs to be affordable. So what's beautiful about the herbs is I can sell this for $3 an ounce versus selling you this bottle for $99. Which means that if I need to get you on multiple concoctions of the herbs, which is what we usually do, it's going to be somewhere in between 15 and if you're really complicated, $30 a month for me to give you what you need in the herbs because they're cheap and I can mark them up and make myself a little bit of a profit without breaking the bank as far as it goes for you. So what my typical herbal recommendations will look like is they will come either in the form of an herbal tea or an herbal tincture. The difference in between an herbal tea and an herbal tincture is that a tea is a whole bunch of herbs mixed together that you make a tea out of. So you pour hot boiling water over it, let it sit all night long, drink it, that's your prescription. So I ask you to ask yourself my favorite question, which is, what is your doctor prescribing? Are they prescribing you a whole host of pharmaceuticals that we know have a bazillion side effects? Or are they prescribing you something that's good for you, that is also very inexpensive so that you can continue to do it? Now, on occasion, we have individuals who refuse to drink tea. I don't like tea, I don't want to make it, I can't handle drinking 5 to 6 cups of water a day, I travel, and in that case, we can make it in the form of a tincture. What we do is we just take the exact same herb, we concentrate it into the form of a tincture. Now you can have your herbal recommendation in 3 drop-her-fulls twice a day instead of 4 to 6 cups of liquid, but you're getting the same thing. $20 to $30 a month, $15 to $30 a month. So that's my whole goal as a doctor, is I want to find a way that you can get the health that you're looking for in a sustainable manner, where if you're getting any sort of side effects whatsoever from the treatment protocol, they're positive side effects. Like if I give you calendula for your digestion, what that's also going to do for you is boost your immune system and make your skin look fantastic. So my side effects are always going to be positive, rather than all of the negative side effects that you get from pharmacology, which often is death or degeneration of the body. Now, my focus as I'm working with every human is to figure out where is the originating cause of the problem that they've got going on. If you are smart and or lucky, or I'm lucky, you're actually coming into my office wanting to prevent things. Because of course, the more that we can prevent, the better off we're gonna be. So most of my patients will get better within 5 to 6 visits or 5 to 6 months with chronic conditions. Then they stay my patient for health maintenance and prevention. We can use the herbs to just support your health on a daily basis. And of course, that's the cheapest, it's the most fun, and then we have a great relationship because we're really just there to continue to support your health. But we always start out with figuring out, well, what is the cause of your problem? And then figure out how to heal that cause so this entire linear host of symptoms just starts going away. Does that kind of make sense for everybody? So I want you to ask the question, what is your doctor prescribing? Now, what I want to do now is I want to go into a demo. Let me check the time because we want to be really honoring to the people coming in after us. I want to go into a demo of what quantum neurology is, because quantum neurology is the #1 thing that just blows the doors off my office. And it blows the doors off my office in as far as how many people get referred to me, which is fantastic. Like I've got osteopaths that refer to me, medical doctors that refer to me, massage therapists that refer to me. Most of my patient database also refers to me because their results are so great that they're like, oh my God, I want other people to get this. But what's more important to me is it blows the doors off my office as far as the results that people are getting. Most of the time when people come to me, they come to me with a problem. I can help their problem very, very quickly. Then the fun begins, because then they start saying, oh my God, I didn't even tell you about my chronic constipation and that's gone. I didn't even tell you I was having insomnia and that's gone. I didn't even tell you, I actually had a woman come in today, or not today, this last week, it was like on Thursday, and she goes, I've been seeing you for a year. She met me at the metaphysical fair. She had a complete adrenal burnout. So she was fatigued, could barely get out of bed, was very depressed, brain fog, couldn't think, digestive disorders, all from complete fatigue and adrenal burnout. And most importantly, she was this far from tossing her husband out the door, divorcing her husband. So when she told me about her husband, I was like, oh my God, this guy sounds like an asshole. You should definitely be And then a month later, she brings her husband in, and I'm talking to the husband, I'm like, this guy is amazing. Like, what in the world was she talking about? Her problem was not her husband. Her problem was that her health had degenerated to such a point that she couldn't even function in her marriage anymore. Now, a year later, her husband sees me, her 3 daughters see me, she still sees me, and all of them have fantastic health. So that's what my goal is all of a sudden I get to meet all your families and you guys are all happy because we've helped you truly get the health that you deserve. The primary way that we do that is through this beautiful technique that I'm going to demo on you, which is called quantum neurology. However, in my lecture advertisement for today, we also said that I was going to talk to you about Candida. So let me just, so I don't waste people's time, show me a raise of hands of people that are specifically here to hear about the Candida. Okay, there's a couple. That's all right. So we'll go through it really quickly. The reason we want to start with that is everything else I'm about to talk about will make more sense if we have an understanding of this. So I'm going to repeat something that I've already said 3 times. My goal as the doctor is to find out what is the primary cause of what is going on with you and heal that. Because if I just throw, whether it's a bunch of pharmaceuticals or a bunch of tinctures or a bunch of teas, if I just throw all of that stuff at you to handle your symptoms, I'm going to make a lot of money. You're going to be very busy all day long figuring out how to do the dosages and everything that I tell you to do. Your symptoms will feel better, but you're actually not going to get any healthier long term. The reason that we talk about Candida is one of those things that if you have it, you're shooting yourself in the foot to do anything else before you actually handle your Candida. So what is Candida? Candida is basically it's a yeast, it's a parasite that grows within our physiology. This is the grossest thing in the world. I learned this just a couple of weeks ago when I was researching more and more about the Candida. Candida occurs in every human being. It is a healthy thing that occurs within our physiology. It has one function and one function only, which is to degenerate or deteriorate our body after we die. Isn't that gross? I read that and I was like, that is the weirdest thing. So we literally have something that is living in us that only has one function, which is to take care of us and get us off planet Earth after we die. But what happens to Candida is if you feed Candida the stuff that it loves, it will overgrow in your entire body like a parasite. It literally takes over every area of your body. And the end result of this is what? Like if Candida has one function, which is to degenerate your body after you die, if you have an overgrowth of Candida, what do you think is happening in your body? Yeah, you're dying. You're dying very slowly, but you're absolutely dying. Which was why, have you ever seen the list or heard of the list of fibromyalgia? It's like 27 symptoms long or something like that. If you compare the list of fibromyalgia with the list of Candida, it's exactly the same, except add about 150 other symptoms. So almost every negative symptom can be traced back to Candida. Doesn't mean you have it, it just means it's something you need to consider. Because if you don't take care of it, it's gonna basically shoot you in the foot for anything else that we're trying to do. So Candida is the first place we always look. Every single human being that comes into my office, first thing we do is give them a Candida test. So what Candida is fed by is pharmaceuticals, as well as sugar, high fructose corn syrup, artificial sweeteners, and I'm missing one, wheat, especially GMO wheat. So interestingly enough, everything that is bad for us, Candida loves. So if you've ever had a time period, college, where you might have experienced an inundation of all of these things, you might have a Candida overgrowth. The awesome thing is you can either go to your medical doctor and they can give you a test that costs them about $150 to do, so they're going to charge you $350, and it gives you about a 75% feedback on whether or not you actually really have Candida. Or if you'd rather, you can take this test at home for free, and it will tell you 100% whether or not you have Candida. So what I'm going to do is I'm going to pass this test around, because there's many of you who have made an appointment to see me over the next couple of weeks. And I want this test. I want the results of the test before I start talking to you. Otherwise, I'll send you home with the test and then we can't have a conversation until you get back. So if you guys are just interested in like, gosh, I wonder if I have Candida, free test, take it home, share it with your friends, share it with your neighbors. If anyone is doing the test in their home, whoever it is that's sleeping next to you or in the next room should probably do the same test. And so if you do have Candida, which unfortunately over 80% of the population does, prior to this cleanse, the only way that you could treat Candida is with severe dietary moderation. So you basically cut out everything that Candida loves, and you do that for the rest of your life. Which means that for the rest of your life, you don't eat sugar, you don't eat wheat, you don't eat processed foods, you don't eat GMOs, and you don't take any pharmaceuticals. Because including like alcohol and even some of the positive sugars, which are like high sugar fruits, which are like watermelons and cantaloupes and honeydews and all of that deliciousness. So prior to this cleanse, just don't eat that for the rest of your life and you're going to be completely fine, which we know is an impossibility. Most of the time people come to me and say, oh, I've been working on Candida for years, and I say how, and they say diet mediation or diet mitigation. And what that does is all it does is it takes the Candida growth from like crazy down to tolerable, but it doesn't actually get it down to the level that it's supposed to be. This cleanse will completely eliminate Candida within 35 days. So that's unheard of. Meaning, if you do the cleanse correctly for 35 days, you will completely get rid of Candida and you will never have to deal with it again for the rest of your life, unless you go through college again, where you're drinking 7 times a week and taking a bunch of drugs. So, the way the Candida cleanse works is we give you probiotics for obvious reasons, because you got to heal the intestines, but we also give you this beautiful little pill, which if you don't have Candida and you take this pill, is complete, meaning when I say Candida, if you don't have a Candida overgrowth, right? Because we've come to the common consensus that a tiny amount of Candida exists in your body at all times, just waiting for its job, which doesn't occur for 80 to 90 to 105 years. So in the presence of normal Candida, you're going to be healthy in the presence of an overgrowth. So everything we're talking about is Candida overgrowth. So this pill, if you take it in the presence or the absence of a Candida overgrowth will be completely inert in your body, meaning it flushes through your body and nothing happens. With Candida, what it does is it starts breaking down the chitin layer. So, do you know cockroaches, how they will literally survive an apocalypse and a global destruction because they've got that really thick chitin layer? Candida also has a chitin layer. So the reason that Candida is so impossible to get under control is because of that chitin layer. So basically you take these pills according to the recommendations that we've got over a period of 35 days. Every life cycle of the Candida, which occurs every 10 to 11 days, the next life cycle will have a thinner and thinner and thinner and thinner and thinner chitin layer. So pretty soon, by the end of the 35 days, you're the only Candida that exists in your body are naked little Candidas, which are very easily squished. It's really that simple. So that is ingenious. This pill has only been in existence for 7 or 8 years. For human consumption, it's been used forever for flea control in animals. So that's how easy it really is, as long as you're knowing what's wrong with you and then addressing it in the right way.
And then it's done?
Excuse me.
And then it's done?
Well, then you will get back to the normal level, which if you are not smart, you can totally bring back. Like if you go to college again and take all sorts of pharmaceuticals or drugs or drink tons of alcohol, yes, it will come back. But then it is completely done unless you go back to a destructive life cycle. And a destructive life cycle is too many pharmaceuticals, which in my opinion is anti-pharmaceuticals, or too much sugar, or too much alcohol, or too much processed foods. So, next thing that I want to do is the most important thing, which is yes.
Can I ask you another question
Yes.
before you go any further? Can you explain the bottom part of it? It says, what does it look like?
Yep, so basically what you do, if you look at the cleanse, you take a glass that you can see through, like a highball glass, put some water in it. First thing in the morning, before you do anything else at all, work up some saliva, so in a nasty, fresh, gross morning mouth, no water, no brushing your teeth first to make sure the test is negative, but your first nasty, gross morning mouth, you spit in the water and you watch what happens. And you simply watch what happens over 3.5 minutes. So basically the Candida, or the saliva, will float at the top of the glass. If you do not have candida, you can spit in the glass, walk away for 8 hours, come back and go, ew, and it's still sitting there floating on the top of the glass. If you have candida, the candida starts interacting with the water and it starts actually dissipating and going down. So a mild candida infection will show little tendrils and strings that kind of hang down in the water. That's mild. Medium is that the tendrils come down into the water and then kind of start dissipating out into the entirety of the glass. That's a mild, moderate infection. If the candida is a bad infection, it will literally tendril down and then blob and sink to the bottom. So basically how quickly that happens, over 3 minutes, is how bad your candida infection is. And that lets us know how long might it take in order to reverse it for you, because 80% of the time, one 35-day cleanse is all you need. If you're the 20% that has like a, oh my God, I can't even believe you're walking right now, bad candida infection, it might take 2 cleanses. Go ahead, I'm gonna answer one more question because I want to make sure to get in the neurology, because that's the exciting part of the lecture. So, and then we're gonna answer questions at the end, but go ahead.
Quick question, so with the pills, is that the colloidal silver, or what was
So the 3 things that you take are colloidal silver, the pills that are called lufeneron, and probiotics. But you take them according to our recommendations. So if you were to just randomly take these and not according to our recommendations, they may or may not work for you. You have to do it according to the calendar. But lufeneron, Lufeneron, lufeneron is the magic substance. Now, you're going to go online and you're going to research it. So what's important to note is both colloidal silver and lufeneron, you can get a bad quality one or a good quality one. Everybody knows that if you come into my office and you have a fantastic experience, you're going to tell 1 or 2 of your friends, right? If you come into my office and I'm a total bitch to you, you're going to go out and you're going to like every single person on planet Earth, right? So if you go online and research colloidal silver and you pull up one article of one guy that turned blue or had a bad experience, it doesn't mean that all colloidal silver is bad. And with lufeneron, there are multiple places you can get it. The cheapest place you can get it is from China, and it has been laced with pesticides. Don't do that. So if you read an article about somebody who died from lufeneron, they didn't die from lufeneron. They died from the pesticides because they tried to buy a cheap lufeneron, just so you know. We're going to get into neurology because this is my most exciting topic. And this is the thing that I have the most fun with in my office. So the concept is, if your nervous system is working, whatever your nervous system is feeding is working. Your nervous system is literally the point of connection in between the physical and the non-physical. So how God or the universe or whatever you perceive the power that created us to be, how that power makes us alive is through the nervous system, which is why if the nervous system is working, we will be as vibrant as we want, we will be as happy as we can be, and our body will work at all times. So most conditions can actually be traced back to something in the nervous system that has stopped communicating as effectively as possible. So when I talk about the nervous system, I want you to visualize a cell phone conversation with your best friend or your mother. If your cell phone is clear, you can have a great conversation. If your cell phone has a lot of static, you could be telling your friend or your mother the best thing on planet Earth, and they'll hear every 3rd word and not get the communication that you're providing. It has nothing to do with your communication. It's the fact that they cannot receive the proper communication. So that's the concept of the nervous system. I could throw herbs at you. I could throw nutritional supplements at you. I could make you do physical therapy. I could let go of all of the energy that you're carrying from your past lives. And if your nervous system is not working, nothing is going to be working. So our number one focus at all times is wake up the nervous system, wake up the nervous system, wake up the nervous system. So we can detect and correct any neurological interference within the entire human body. So there are 3 areas of the nervous system. There's the cranial nerves, which is basically everything from my neck up, all of the nerves that exist in my brain. If you get a brain trauma and those nerves start going staticky, that's going to result in TBI, traumatic brain injury. That's going to result in a concussion. That's going to result in any sort of perception distortion. We have a 100% success rate at fixing ADD, ADHD, and dyslexia just by waking up the nerves in the head. 100% success rate at dyslexia. Nobody else will ever tell you that, because if the nerves in your brain are working, you can read. If the nerves in your brain are working, you can process incoming information effectively. So if you have a concussion, if you have an old brain trauma, old brain injury, brain tumor, any sort of learning disability, but also the thing that we do a really great job at is anything that is a degenerative information processing issue. So that is, I'm sitting at a computer screen all day long, and so I start getting headaches, or I can't read very well, or my eyes are starting to get old, I can't see very effectively. The lights in my office give me headaches because it's all processing. So if we're working with the cranial nerves, pretty much any issue that you have from the neck up, we can recover by making sure that the nerves are working the best that they can. Then the second area is everything from the neck to the belly button. So that's pretty much every organ within this area of my body, as well as my hands. So people will come in with a rotator cuff injury that they got surgery on, and it's still never been the same. And all of a sudden we test the nerves, and the nerves to the rotator cuff aren't working. So I don't care how many times you do surgery on the rotator cuff, if the nerves are not working, that is not going to heal. I don't care how many bicep pulls that your physical trainer or your personal physical therapist gives you, that nerve, if it's not working, you will never get strong. All of a sudden we wake the nerve up, and old rotator cuff injuries that have been around for 20 years totally heal. We can even prevent rotator cuff surgery if you're willing to be patient enough by waking up the nerves enough that those tissues know what to do, and all of a sudden that rotator cuff starts healing again. Same is true with the thyroid gland. The number one condition that is happening in America today, and I will bet you that at least 15 to 20% of you have been told that you have some sort of a thyroid issue, because the nerves to the thyroid get affected by radiation and electromagnetic frequency. So anybody who ever has used a cell phone has a potential to have thyroid issues. So what they'll do is say, oh my God, you use a cell phone. Well, we'll get you on Synthroid, or we'll get you on thyro, I don't remember what the other one is. But as soon as you get on a thyroid medication, you're guaranteed to be on that medication for the rest of your life. Conversely, if we just test the nerves to the thyroid and wake them up, holy crap, all of a sudden your thyroid starts working. Same thing with the lungs. Asthma, bronchitis, any sort of lung issue. Same thing with your heart. We've actually healed valve issues just by waking up the nerves to the heart, and all of a sudden the heart starts working. And anything from the belly button down is pretty much anything that your legs can do. Oh, I get chronic hamstring pulls. My knees are really weak. I always twist my ankles. I have major disc issues. All of that can be fixed just by waking up the nerve to feed and stabilize that area. But we also have 100% success rate at fertility treatments. So infertility is also one of the primary disorders that is affecting a shocking 50% of couples now that are trying to conceive. Because the number one thing that affects the nerves that go into those organs are GMOs, processed foods, and sugars, right? So the more that we get that in the body, the more all of a sudden those nerves are not working, and all of a sudden we have fertility issues. All you have to do is wake up the nerves, and then we also have some herbs to support it at the same time, but you wake up the nerves to that area, and all of a sudden that area starts working again, and then the human body does what the human body will normally do, which is reproduce. So that's the concept of quantum neurology, is we can localize any nerve in the human body and wake it back up. So what I need is somebody who has had a